First aid have three goals. 1. Preserve life. The overriding aim of all medical care, including first aid, is to save lives. 2. Prevent from further harm. Also sometimes called prevent the condition from worsening or danger of further injury. This covers both external factors, such as moving a patient away from any cause of harm, or applying first aid techniques to prevent worsening of the condition. 3. Promote recovery. First aid also involves trying to start the recovery process from the illness or injury, and in some cases might involve completing a treatment, such as in the case of applying a plaster to a small wound. Importance of first aid. The principles. First, do no harm and life over limb are essential parts of the practice of first aid. Knowing proper first aid procedures can save lives. It reduces the chance of infection, pain, bleeding, and scarring. It prevents danger of further injury. It meets the needs of unexpected occurrences in the community or simply within own household. It potentially saves lives with the use of minimal equipments. It is able to cater to minor injuries and illnesses without the hassle of going to the hospital or clinic. It provides emergency first aid management of injuries and illnesses until medical aid arrives. Guidelines of first aid. You can use the acronym EMCAP or MCAP. E. Environment. Check the environment if it is safe for yourself and the victim. M. Mechanism of injury. Observe the possible mechanism of injury, like a fall from a ladder, or from a dislocated shoulder, due to a motor vehicle accident. C. Casualty. Count how many casualties were injured. A. Additional resources. Call for additional resources such as a medical aid or even a bystander. P. Personal protective equipment. These are your gloves or your face masks. Try to remain calm at all times. Look around to make sure the area is safe. Make sure you are safe before providing care. Assess the situation. Try to find clues about what has happened. Estimate how many victims needs help. Call for additional help. Grab and apply personal protective equipment or don gloves, if it is available. Act quickly and communicate effectively while assessing the victim. Speak loudly to him or her. Tap the person and ask if he or she is alright. Introduce yourself and explain that you are a first aider, and that you are there to help. If the person is conscious and able to speak, ask the injured or ill person what happened. Listen to the injured or ill person. Let the victim know that you will be performing some first aid procedures to help him or her. Check the victim for injuries and look for these things: severe bleeding, changes in consciousness, irregular breathing, unusual color or feel to the skin, swollen places on the body, medical alert tags, anything the person says is painful. If the person is unconscious, you may need to start performing CPR. After the emergency, document the interventions performed. You may need an incident report. Try to remember as many details as you can. Report only the facts, not opinions. Remember, in an extreme emergency situation, never do anything that is beyond your ability or training. Stay within your scope of practice. Give basic first aid until the emergency medical aid arrives.